Heart disease is the biggest killer, the number one killer.
That the major killers in India are three: hypertension,
have a gun. The trigger is in our hand.
We call दिल तो पागल है टाइप का ECG आ रहा है ये, and we give a count.
Control your hypertension, control your diabetes. We are the diabetic capital of the world.
Good morning, ladies and gentlemen. On this momentous occasion of World Heart Day 2024, I am honored to welcome you to our program initiated by Medgate Today TV Digital. Today, we gather with a shared purpose to shine a light on the critical issue of cardiovascular health and take collective action against the world's leading cause of death, cardiovascular disease, CVD. Cardiovascular disease is a silent and relentless killer, claiming around 20.5 million lives each year, with 80% of these deaths occurring prematurely. Alarming as it is, many of these deaths are preventable. The conditions affecting the heart and blood vessels, such as heart attacks, strokes, and heart failure, predominantly impact individuals in low and middle income countries, highlighting a global health crisis that demands urgent attention. Heart disease accounts for approximately 31% of all global mortality. Yet, this reality remains under-recognized. It's essential to understand that cardiovascular diseases are not solely a result of genetics. They are often influenced by lifestyle choices and a lack of awareness. This year's World Heart Day theme, Use Heart for Action, serves as a powerful call to action. I would request my Editor-in-Chief, Mr. Afzal Kamal, to say a few words on this World Heart Day 2024.
Hello friends and viewers of Medgate Today TV Digital. As we mark this important day, it's essential to recognize that heart disease continues to be a leading cause of death worldwide. But the good news is that we have good doctors and advancement in medical sciences, combined with awareness and lifestyle changes, are helping us to combat this growing crisis. Let's embrace the theme, Use Heart for Action. Yes, this is the theme of our World Heart Day this year. And our hearts are not just for beating, they are for caring, advocating, and inspiring changes. As we are facing a lot of health issues, challenges, and world need it's time to take action. Small steps can lead to be significant impact. Our esteemed panel are here to discuss the various aspects of heart diseases and its well-being. So the panel will delve into the latest breakthroughs in cardiac care, the role of technology, prevention, and strategies, and much more. So let's watch. Thank you so much.
Today, we are privileged to be joined by a distinguished panel of experts who will provide invaluable insights into maintaining heart health, debunking myths, and exploring effective preventive measures. Please join me in welcoming Dr. Ashok Seth, Padma Bhushan, Padma Shri, Interventional Cardiologist, Chairman at Fortis Escorts Heart Institute. Dr. T.S. Clare, Padma Bhushan, Cardiologist, Chairman at Max Hospitals. Dr. Surendranath Khanna, Adult Cardiothoracic and Vascular Surgeon at Fortis Escorts Heart Institute. Dr. M. Wali, former physician to the Presidents of India. Dr. Vanita Arora, Senior Consultant, Cardiac Electrophysiologist and Interventional Cardiologist at Apollo Hospital. Their knowledge and experience will guide us in understanding how we can keep our hearts healthy, fit, and in rhythm. Let's begin our discussion with a question that highlights importance of interventional cardiology. Dr. Seth, as you are an interventional cardiologist, could you please explain its role in the overall treatment of cardiovascular diseases?
So, interventional cardiology is a branch of cardiology where many treatment of heart disease, which used to be done by surgery in the past, can now be done without surgery. Now, we are not surgeons, we are cardiologists who then specialized in this field. By the way, interventional cardiology is a field which arose gradually 50 years ago by opening up blocked arteries with a balloon. So it is called angioplasty. In the 80s, when I trained in angioplasty, we used to open up the first ones, say, where blocked arteries could be opened by a balloon without opening the heart up, without opening the chest up. Because prior to that, only open heart surgery, as one would say, had existed, which is opening the chest and really putting grafts on the heart. But once we started opening up blocked arteries in the cath lab, in a conscious patient, by going through the arteries of the groin and getting into the heart arteries, this field gradually became much better because it was crude in those days, and over the last 30 years has grown as the mainstay of treatment of heart disease and blocked arteries and prevention of heart attacks, treatment of heart attacks, treatment of angina. In fact, as you know, coronary artery disease or heart attacks is the biggest killer. Well, the mainstay of treatment of blocked arteries these days is interventional cardiology. And interventional cardiology has grown and refined itself to be a safe, simplified procedure done in cath lab. Conscious patients open up multiple blocked arteries, even in sick patients, has also grown into treating valves of the heart without surgery. In conscious patients, has grown into treating multiple aspects of structural treatment of heart disease, and thereby leading to a discharge of the patient in 1 or 2 days, walking around with a safety which is greater than ever seen before, of more than 99% to 99.5%. So interventional cardiology has now become the established field of specialization in cardiology. And we are not surgeons, we are cardiologists who are able to do techniques and technology which is replacing surgery through minimally invasive methodologies in a very safe environment in cath labs rather than theaters. And patients' recovery is faster and mobilization is faster. But by the way, science has progressed to be complementary. I don't think we're talking about surgery or angioplasty or interventional cardiology. We are saying these are various and we need every tool at various times to treat a patient with heart disease.
Thank you for providing a great explanation on interventional cardiology. My next question to you is, sir, with the advancements in technology, robotic surgery has become a pivotal area in cardiology. Please shed some light. How is robotic surgery enhancing our capabilities, and what are the benefits of minimally invasive techniques compared to traditional surgical approaches?
Yeah, more and more, we know that intervention techniques have gone safer and have been very effective as science has progressed over the last 20 to 30 years. Everything's got more refined. And even surgeons have themselves joined us in multiple ways to promote minimally invasive techniques because that's what the surgeons would also like to see. So in a way, we would say progress of science, especially for the treatment of heart disease, in the last 15 to 20 years has been a path which has been united between the surgeons and the interventional cardiologists. And if we do minimally invasive, be it through surgery, be it through angioplasty methodologies or interventional cardiology, which we say is angioplasty. You've heard of transcatheter aortic valve implantation or TAVI. You've heard of mitral valve repair of leaking valves through mitral clips, which is all non-invasive, minimally invasive. It is safer. It has less complications. It is done without general anesthesia, most of these procedures. It is done under sedation only. It is rapid discharge from the hospital, sometimes within 24 hours, after a major procedure of a valve replacement. It can be done at any ages, elderlies especially where the risks of surgery are high. And it's rapid return to work within a week, full return to recovery, with no major cuts on the body and therefore no major healing processes or complications. So in all ways, this is why the progress of science has been looking at less invasive methodologies. And by the way, these less invasive methodologies are not any lesser than surgery. In fact, in many a times, their results have been superior to surgery. So I think science is together progressing on the frontiers between the surgeons and interventional cardiologists to say, how can minimally invasive, the same things be done in a less invasive manner with better outcomes, with greater safety and faster return to work. That I think is a very important aspect of what we do now compared to what we did, say 20 years ago or 25 years ago.
That's very insightful, sir. Now, my next question is to Dr. Clare. Sir, there are two terms that often create confusion. First one is cardiac arrest and the second one is heart attack. Could you please clarify the difference between these two?
Very important question. I must compliment you for asking this question because people in India have no idea what is heart attack and what is cardiac arrest. Cardiac arrest means that heart is not able to generate blood pressure. That means blood pressure is either 0 or 10 or 20 or 30. So when the blood pressure is so low or there is no blood pressure, the patient becomes unconscious. And if that patient does not get CPR, he will die within 2-3 minutes, 3-4 minutes. Now, what is heart attack? Heart attack is a condition where, we have the heart muscle is supplied by the arteries. Like there are mainly two arteries, the left coronary artery and the right coronary artery. Left coronary divides into two branches, we call it LAD and circumflex. So when any of these arteries block suddenly, 100%, so there won't be blood going to that particular part of the heart muscle. So if that happens, that heart muscle will start crying, patient will have severe pain, and if you don't relieve that obstruction, that part of the heart will become dead. That is called heart attack. Technically, it is called myocardial infarction. Yes, if there is a major heart attack, for example, a major artery is blocked, it can cause cardiac arrest also. But every heart attack doesn't produce cardiac arrest. Only minority, around 10 to 15% of heart attacks can cause cardiac arrest. Rest of them they don't do. But every cardiac arrest is not heart attack. Actually, most of the cardiac arrest patients, they don't have a heart attack. They have already some pre-existing heart disease. They are either they had a previous heart attack or they have some kind of heart muscle disease where their heart has become weak, and these patients are more prone to get cardiac arrest. Anybody with ejection fraction of less than 35%, like ejection fraction is a term which we use for describing the pumping capacity of the heart. Normal ejection fraction is around 60%. So one of the major risk factor of sudden cardiac arrest or sudden cardiac death is when those people where the ejection fraction is below 35%, particularly if it is below 30%. So these people can get, a condition called either ventricular tachycardia or ventricular fibrillation, which can cause cardiac arrest. And these are the patients who need immediate CPR. And in cardiology, actually, this is one of the challenge areas. So we tend to identify, before these people develop a cardiac arrest, we identify who are those patients who can develop cardiac arrest in future, and those are the patients where we can save them by giving ICD.
Excellent clarification, sir. Moving on to a critical life-saving skill, that is CPR. Dr. Clare, given its importance, do you think it should be mandatory for everyone to learn how to perform CPR?
Very, very important question. I think there should be a national program under the Ministry of Health to teach CPR to each and every person in India. There is no knowledge in this our country. Even the educated people do not know. If a patient becomes unconscious in front of, they don't know what to do. They do something very, very foolish and very wrong. They try to put water in somebody's mouth. So please, I will advise you that when a person is unconscious, never put any fluid into his mouth, because that will go to trachea and they will get aspiration pneumonia. So in India, I think there is a very, very dire need to teach basic principle of CPR to public.
Thank you, Dr. Clare. Moving ahead, I would like to take some insights from Dr. Khanna. So, Dr. Khanna, my question to you is, How do you define adult cardiothoracic surgery and how does it differ itself from other specialities?
Yeah, I mean the adult cardiac well, surgery, it encompasses all the acquired well, diseases of the heart which can be prevented. It is different from the pediatric or the congenital heart well, surgery which occurs when the baby is born or a child is born because of the inherent defects in the development of the child.
My next question to you is, how do you see post-recovery of a patient after having a cardiothoracic surgery? How do you make them stable mentally and emotionally to get the recovery faster?
Yes, this is I think a very pertinent question because there is a fear in the patient's mind कि एक बार heart का अगर operation हुआ तो 3 महीने तक bed पे रहेंगे. It is absolutely not like that. On the second day, the patient starts walking in the hospital. He can climb stairs as well, and he is discharged after 5 or 6 days. And the only thing he has to do is to wear the chest belt is there, binder. Other than that, he is totally active. He can do anything. So the recovery takes it's extremely fast. It's a short recovery. And other thing, the use of the blood and other things have been minimized. So if the patient takes proper care of his diabetes and blood pressure and other things, then his life is almost equal to the normal life of a person.
Now let's delve into electrophysiology. Dr. Arora, could you please explain what it involves and its significance in cardiovascular health as you are an electrophysiologist?
Cardiac electrophysiology is a very interesting and a very challenging field of cardiology. It deals with heartbeats and heart failure. So, slow heartbeat, faster heartbeat, patients go to any cardiologist. It is a very specified field. We as cardiac electrophysiologists are trained ahead of rest of the cardiologist for a couple of years to be good in cardiac electrophysiology. This is my very good friend, she calls it bijli ka locha. So that is the layman's terminology which is used to explain what is cardiac electrophysiology. Why they say bijli? Because heart beats are the electricity of the heart. So when the heartbeats become abnormal, whether it is faster heartbeat or whether it is slower heartbeat, it becomes, there is a locha, there is a problem in that. That is what we fix. So we call ourselves as proud electricians of the heart.
That's very fascinating, ma'am. Let's discuss advancements in leadless pacemakers. How do they compare to traditional pacemaker systems?
Traditional pacemaker systems have been, the first implant was done in 1967. It is an implant which requires a surgical incision, a surgical pocket being made below the clavicle bone, and a lead being inserted in the inside the heart, the right upper chamber and the right lower chamber of the heart. So as the traditional pacemakers go in, they are being done at many places in India, but patients come back with a lot of problems like lead fractures, insulation breaks, wear and tear of the leads, and surgical pocket getting infected, extrusion, explantation. So we have to actually remove the system, and the patient passes through a lot of not only economical burden but physical burden also, because they have a lot of pain and there are a lot of challenges which occur. So we have been looking for another system to help such patients, and leadless pacemakers have come in a very good way to help these patients. This is a small capsule. It is just a vitamin pill size capsule which is taken on the catheter, and it is inserted through the vein of the leg inside the heart, the right lower chamber of the heart. We insert it there and we remove the catheter. So the procedure is done without any surgery, no pocket erosion, no pocket infection, no leads involved, because that capsule has just the tines which will hang there right? The latest advancement which has occurred in leadless pacemaker is that initially we had a single chamber pacemaker. Now from January or maybe February to 2025, we will have dual chamber pacemaker, leadless pacemaker available, which means one capsule we will put in the upper chamber, one capsule we will put in the lower chamber. Earlier we had it from the company called Medtronic with the pacemaker named Micra. Now we are going to have it from Abbott and the pacemaker is called AVR.
It's very interesting, ma'am. Thank you for telling us this. Now let's move to our Dr. Wali. Dr. Wali, you have quoted this World Heart Day as Dil to Pagal Hai. Could you please tell us how does this phrase resonate with our theme, that is use heart for action? What message are you aiming to convey through this combination?
Well, despite so many deaths in youngsters, we are not able to fix the cause and prevent these deaths which are happening, especially after COVID. And I was very much pained to see 11 young boys and girls dying in a recent recruitment of excise inspectors. And they were simply just washed. Nobody bothered that 11 young lives of India we have lost while we make the candidates run. So that really hurt me, and I spoke also on this, that there is no need to make boys run for 10 kilometers while our Honorable Health Minister Mansukh Mandaviya ji has cautioned against such a vigorous exercise after we lost young boys and girls in Dandiya at Navratri. So this is something which hurt me, and I could just fix it in a catchable or catchy term, or in a way I will talk further. Some deaths in this could be arrhythmias. So when the ECG becomes haywire, we call dil to pagal hai type ka ECG aa raha hai ye, and we give a counter shock by DC, and then we revive the heart. And this is called DC cardioversion through the life pack. So I wanted this to attract the general public, as the theme also says, use heart for action. And we are going to sign global petition also to be noted by our administration, international bodies, national bodies, and everyone, that we should work in this direction. Otherwise, we will continue losing so many lives.
That's very interesting, sir. Thank you for telling us how Dil to Pagal Hai is resonating with use heart for action. My next question to you is, sir, could you please tell us what role do emotions and mental well-being play in overall heart health?
First of all, eat right. Now the generation is growing with eating wrong, and they don't know the consequences. They will come to know after 20 years. What they've eaten in the childhood is now causing coronary blocks. People are talking about French fries, burgers, pizza, pasta, consuming high amount of cheese. So all this is harmful for the heart, and we are not monitoring lipid profile early in the age. We have done research in Gangaram Hospital so that we can check the lipid profile at college going age, and that means a lipid passport for the admission to the college. That means we should be alert at the college going age, which is usually 18 years, 19 years. At the same time, we should promulgate the message of anti-smoking. We should not let the children smoke. What our government has done is working though, but further stringent action is required. Third is sleep. Everybody is sleep deprived. If you call somebody in the morning, you'll find him sleeping or yawning. So this is what the sleeping pattern has changed. Within our days, my cot was kept in the sun if I am sleeping till late on Sunday morning. So this was the training. There are no joint families, so such training is missing. Sleeping early, getting up early was the actual timetable of the life. Now we hardly get up early and everybody sleeps late. So this is what is causing undue stress on the heart. Then negative thinking, failures, youngsters leaving job, in a spurt of time. This is also affecting. Now I will come to actual cause, that is cholesterol, hypertension, diabetes, obesity. These are the additive standards, risk factors, family history. So these are also to be seen. We have gained 7 to 8% diabetes in the young after COVID, which is very bad. And we have also gained obesity 8 to 9% after COVID. And very recent WHO report halted me also, which was published in Lancet, and that says 62% of Indian females and 54% Indian males do not conform to WHO's standards of health. This is very sad. If you go to Japan, people don't hesitate in walking. But in our country, people feel pride in going into the cars and getting down, same, don't use lift, eat more, and lot of sugars, lot of carbohydrates in our diet. Even vegetarian people don't eat vegetables, they eat more of roti, which brings in white part of the wheat, which we call maida. So all these combined leads us to think very seriously for protection of the heart and living long. Everybody knows it, but nobody follows it.
As we are heading towards the end, my common question to every panelist is, what are the key action you think people should take to prevent heart disease and promote cardiovascular health?
Heart disease is the biggest killer, the number one killer across the world and more so in India. Any one of us, including myself, is susceptible to a heart attack. And therefore we need to prevent it. Prevention of heart attack is in our hands. 45 minutes of walking 5 times a week decreases your chances of heart attack by 25%. I say prevention of heart attack is not just in our hands, it's in our feet. Do it, exercise daily. Be healthy, be fit, have a healthy heart.
They play a great role because heart is governed by man, and man lies here in the mind. So there is a risk of secreting more adrenaline, more noradrenaline, more other hormones like serotonin and basically stress hormones when we are under stress, or we are having anxiety, or we are having a situation of flight and fight. So emotions, positive emotions heal the heart, negative emotion make the heart sick. And for that we have to be contained, we have to be helpful, we have to be positive, we have to help each other, and we should bring in harmonious, jealousy free, जिसको हम हिंदी में कहते हैं ईर्ष्या द्वेष, इस वातावरण को न लाएं अपनी लाइफ में. And we should sleep well with this, and that makes our heart healthy to a great extent.
See, what is happening today in India, that the major killers in India are 3: hypertension, diabetes and heart disease. And believe me, they are all 3 lifestyle disorders. So what is needed is to change our lifestyle healthy. So what is that? It's not a rocket science. Number 1, you have to keep your weight under control. And what is ideal weight? Ideal weight is height in centimeters minus 100. Supposing you are 170 centimeters tall, your maximum weight should be 70 kilograms. So that's one. The second thing is, it's not only weight, also the pate matters, abdominal girth. So the abdominal girth should be less than 95 in men, less than 85 in centimeters in female. Because even if your weight is normal according to the standard, but your tummy is coming out, it is an additional risk factor for development of heart disease. Second, if you have got blood pressure, you must adopt a healthy lifestyle, decrease your salt intake, do exercise. But if the blood pressure is still high, you need some medication. So the ideal control of blood pressure is that BP should be 130/80 or less, up to 65 years of age. If your age is more than 65, even blood pressure 140 by 90 is acceptable. Though we will still like that 130/80 is more desirable figure. Then if you have diabetes, again you should lose weight, avoid sugars, exercise, but if your blood sugars are still not controlled, you need medication. The idea is to keep your hemoglobin A1C between 6 and 7. Hemoglobin A1C is a test which tells you how well your diabetes is controlled. So our target is to have this between 6 and 7. Then regular exercise, 5 days a week at least, 40-45 minutes of exercise is very useful. If you can do additionally some yoga.
In the heart like diseases, the case is like if we have a gun, the trigger is in our hand. The gun, it can be, the genes might be there, but if we have a proper lifestyle, then nothing can affect the patient's heart. So in those, again I will reiterate, these are exercise, a proper diet, and a healthy mind. So all the three are important.
Well, there are so many things that people can do into their lifestyle management, and they can take care of their heart very nicely. Control your hypertension, control your diabetes. We are the diabetic capital of the world. Diabetes is the biggest risk factor for heart disease. So keep them under control. Please do not smoke. It's a no to smoking. And if you are a female and you are smoking, do not take oral contraceptives. Oral contraceptives with smoking is actually fatal. It increases your risk for heart disease 5-fold. So please don't do that. People don't know about this, that's why I'm conveying it, especially for the females. You want to smoke, continue smoking, don't use OCs. And if you are taking oral contraceptives, please do not smoke. Second, next to this is that you have to make exercise a routine. Now I know everybody is busy in their offices and everywhere. So what you start doing is, in the office only, start taking walks. If you have stairs in the office, so don't use lift. Please take stairs. Please go around. When you have to use the phone, everybody is on the phone nowadays. When you have to use the phone, go for a walk. Don't wear heels in your working place. Start wearing Skechers or start wearing running shoes there. I do that. I just, as soon as I enter the hospital, I just change into my running shoes. I wear flats and Skechers or whichever shoes I have. I do that and I keep on walking. We have a huge parking area. I just go out and I walk. I take a long walk, because otherwise, if you have to take out specific time for taking a walk or for exercising, you never get that. So try to make this possible. If stop using lifts, go up the stairs. You will complete your steps every day. Then over and above this, please go back to the tiffin system. Do not eat the garbage that you eat at the offices. Please go back. Take your own tiffin. Going back to school and going back to basics never goes wrong. And whatever garbage you are eating at your working place, whatever, Maggie, burger or pizza or whatever, your paratha cooked at home is going to be much better. It's going to be healthy, it's going to be less on calories than the other garbage which you are eating. So start taking dabba. Yeah, females in the family, they are working nowadays. Everybody is onto the work schedule. The stress has gone up so much. So to reduce that stress, everybody should have me time. It is very best to take out 40 minutes from your busy schedule of 24 hours and concentrate on your me time. You, in that me time, do what you want to do.
As we conclude our program, I extend my heartfelt gratitude to our esteemed doctors and panelists for their valuable contributions today. Your expertise and dedication to cardiovascular health inspire us all. Thank you for joining us in this vital mission. Happy World Heart Day, everyone. Stay tuned and do subscribe our YouTube channel, that is Medgate Today.